is Mrs. J.K. from San Francisco. She presented with painless jaundice. CAT scan showed pancreatic head tumor, possible liver involvement. Diagnosis was made in 2005. Biopsy was unsuccessful, but her CA19-9, which is a cancer tumor marker, was very high. She refused chemotherapy. She was 80 years old. Her PET scan, when we first saw her, showed a pancreatic tumor with possible metastases to the liver. Then 6 months later, we did another PET scan. No sign of pancreatic cancer, no sign of metastases to the liver. She returned to California in August 2006. Her doctors refused to provide the ALA, low-dose naltrexone treatment. She was told she had metastatic pancreatic cancer. Nothing could be done. She died in November. There was only 12 months following diagnosis. Mr. R.C., 69-year-old male policeman from Chicago. He had had prostate cancer, treated conventionally, B-cell lymphoma, treated conventionally. Developed pancreatic cancer with metastases. I treated him with low-dose naltrexone. He was not very adherent to the lifestyle and diet. The pancreatic tumor, metastases to the liver. This is in February of 2007. This is a residual glucose in the kidneys, but the pancreas seems to be free of tumors, and I don't see anything in the liver. Mr. R.C. returned to standard therapy soon after the February CAT scan. He died in standard treatment in November 2007, a little over a year after diagnosis. It seems that many of our patients seem to do very well, and they visit their oncologist, and we usually encourage them to visit their specialists. And the oncologist said, well, maybe if we give you a little chemotherapy, you'll do very well. And I can't, as a licensed medical doctor, I can't tell these folks not to see their specialists. I can only tell them, look, you're doing well right now. You have to do what you think is correct. Some of these people return to their oncologists and receive standard treatment and die soon afterwards. Mrs. A.M., a long-term patient. We saw her originally for hepatitis C with cirrhosis of the liver, which was thought to progress to hepatocellular carcinoma, so she had a primary liver cancer, probably secondary to the hepatitis C virus, and a life of not taking good care of herself. She was first seen in July 2001. The doctors from another well-respected Texas medical center told her that she wouldn't live more than a few months. They diagnosed end-stage cirrhosis with possible liver cancer secondary to hepatitis C. She refused standard therapy. Mrs. A.M. is sometimes adherent to the program, the low-dose naltrexone program, the lipoic acid. She's not adherent to the diet. April 2007, the radiologist that read this PET scan thought that these little areas here probably represented cancer of the liver. Then in August 2007, she wasn't on the program then, it seemed to spread all over the liver with many, many tumors. In August, she decided to follow the protocol more carefully. And most of these liver tumors were not seen in July of 2008. Seems there's only one focus of pancreatic cancer there, but she's still working, feeling well, approximately 99 months following the initial diagnosis. Over here you see the glucose sort of in this area of the lower jaw. She doesn't take care of her teeth, and she has several infections. She refuses to go to a doctor. Mrs. LP, an 84-year-old woman from Las Vegas, was diagnosed with lung cancer. No biopsy. She never smoked. The diagnosis was made by a Las Vegas oncology group. She was first seen by me February 2008. We put her on the program. She was very adherent to her diet, and she came regularly for lipoic acid. She took her low-dose naltrexone. And you could see this large, what they call a Pankos tumor, in the upper right lung. This is February 2008. And she did everything correctly. By May, the tumor is spreading. And I don't know about the liver. It looks like she has some metastases to the liver. So this treatment doesn't seem to be working for lung cancer, or the ones that I've treated. 9 months following diagnosis, progression of the tumor to the nerves of her face and arm. She has pain and partial paralysis of her right arm and right face, and she's continuing with conventional oncology. You might remember last year I talked about the reversal of signs and symptoms of a B-cell lymphoma patient using only LDN. He's still alive and well. October of 2008. Mr. M.W., 80-year-old male with metastatic breast cancer and metastatic colon cancer. He was in great pain and distress when I first saw him. He was considered terminal by his oncologist. And as you could see, he has metastases in his bones, in his liver, in his sternum. Very sick fellow. He went on the program. He's mostly free of pain and distress now. I first saw him April 2007. This is October 2008. Still looks pretty much the same, but these metastases seem to be fairly dormant. You know, they're there, but he's still traveling and going fishing with his sons, and he has the cancer 18 months following the first visit. With all of this cancer, you'd expect him to have expired by now.